eye and ear section. Diagnostic test is on page 772. Diagnostic test. The first test we're going to do is called Fluorescent and Geography. This is a test that they do for you to check all eye problems. Bleeding, retinal detachment, diabetic. But this test is not to check glaucoma. Only retinal detachment, bleeding, macular degeneration. What is this test? This test is an invasive test because we instilling a dye. 772A, 3A. When we put this dye in you, we need a consent. We must ask you, are you allergic to shellfish? Now here it is. When we instill this dye, the dye make your skin yellow. That's a good sign. How do you know the dye came out? Because your pee-pee will be green. If your pee-pee came out yellow, that means your liver was affected. Because the skin should be yellow, but the pee-pee should be green. NCLEX get you on this with the pee-pee color. Again, when you get fluorescent and geography, the dye is injected into the vein to see the eye, the arm. Now, the skin, where they put the dye, is yellow. The skin. When you finish, you should see the patient urine green. That tells you everything went good. The dye is coming out. After the procedure, you got to give the patient a lot of water so the dye can come out. If the pee-pee is yellow, that's a medical emergency. I said the dye, the arm is yellow, not the pee-pee. Sana testimonio. Know the different color. If the pee-pee is yellow, that tells you the liver is involved. The patient may have jaundice, liver disease. It destroyed the patient's liver, which is a medical emergency. Now, when they give you the dye, you're going to see the doctor order Benadryl. Why would the doctor order the Benadryl? Because the dye may make the patient itch. Sana testimonio. Any question? The second test the doctor do for you is called slit lamp. Slit lamp is a test to check the ocular structures of the eye. Slit lamp, you normally do it at the driver's license place. You put your chin on the thing. You put this, right, chin, and then your head go in. Now, what is it that you looking? There's a bright light that's going to go into the eye, and you must look over the examiner ear. NCLEX say you look in the nose, you look in the eye. Where are you looking? At my ear. I'm going to say, hey, Kawan, why are you looking in my ear? This is a driver's license test. When you go get your driver's license, they do this test. That is called the slit lamp. So you look at them. You looking, Zoe, the examiner. Right? While the beam of light got its own light in the eye, I'm going to say, hey, Francis, look at my ear, because I'm looking for structures in your eyes. Any question? Slit lamp. The second or the third eye test is tonometry. Tonometry is to use to measure the pressure in the eye with glaucoma. The normal pressure in the eye is 10 to 21. Let me explain to you what glaucoma is. If you have a river, flowing river, and you throw a rock where the water pumping, right? What happened to pressure? Does it go down or it increase? It increased. That's why people with glaucoma, you see draining, you see mucus in the eye because there's a blockage. So we need to give you a blockage that causes the pressure to go up. So we need to give you medication to lower the pressure, like beta blockers. We give pilocarpine, Zenlatin, Trusop, Azop, Vazine, Maureen to lower the pressure in the eye. Right? Now, any question? On page 771, there's 2 tests you need to know. The Snellen test. The Snellen test is the test that you go when you go to the doctor to get your eyes checked. If I wear glasses, I must go with my glasses. If I wear contact, I must go with it. So ready? You do Snellen test for the eye. Snellen for eye, S-N-E-E-L-E-N, right? It is on page 771.
What's the letter?
2, assessment of the vision. Snellen test is for the eye. Ready? Schilling test. So it goes like this. Snellen, eyes. What nerve is Snellen? Optic nerve number 2. We have Schilling test. Schilling is for anemia. And this we check urine. Schilling is urine. Anemia. Allen tests. ABGs. Adam tests is scoliosis. There's one test that I didn't teach you. It's in eye and ear. You know when the police tell you to stand in the line? Romberg test. Romberg test. Where would you see this? Alcohol.
Yeah.
Any question? Must know the different tests. Romberg, Adams, Snellen, Schilling, Allen. Upaka, you cannot go to NCLEX. They give you these tests and you look. Now, I know the way they word it. They who care the way you word it. I proved that yesterday when we did test-taking strategies. Who was killing me yesterday with test-taking strategies? She was getting it all. She couldn't believe it because she knew the system. Anytime you know the system, you give me good answer. When you don't know the system, it has nothing to the way they word the question. Nothing. Comprendre. I can word a question anywhere I want if you understand the content. When wording is an issue, when you really don't understand, but you really don't understand, so let me figure it. Comprendre. Understand the disease. That's why when you're reading, do not go COPD intervention. I want you to go read what is COPD. So when they flip it, because they're going to flip it, you still able to understand. Ça les good infirmière, good comprendre bon bagay. Depuis un student dit de ouais des filles cause crédit ou pas passer parce qu'on va comprendre. Et comprendre. It has nothing to do with flipping. If I say go a person who do hair, right? I say you know how to do hair, you train. I say give me a bob. A bob. You automatically know how to do a bob because you do hair. You gonna tell me what kind of bob you want. You want it short, you want it long. Where you want the line. Mbaka do bob uba mon lean line. That means you don't understand. Because I don't do hair, but I know bob go in the middle, ain't it? And then. Oh, you can do side bob. Parce qu'on comprend. There you go. That is because you understand. All I have to say, bob. And you're going to say which bob you want. Side bob, middle bob. There's a little bob, you can add color. That's what we comprendre. But if you don't comprendre, on prend, on vire question, on prend en pied, ou pas comprendre, ou vient prendre test, ou pousser porte moun yo bien. You come to NCLEX, chita la caillou. Chita dormi. Any question, right? Cool? It's all about what?
Understanding.
Content. 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 It's not about the heart failure say. Nothing said. What is heart failure? Well, there's two type heart failure. You got left. You got right. Where is the water go? The water goes in the lung. What is heart failure? Blood is not circulating. You see? How can they trick you? I will not take it. Comprendre. And don't tell me it's English. Because my business is based on people who don't speak English and still pass. So what you gonna use now? It's not English. All my students don't speak English. Hell, 99.999 of them don't speak English. All of them don't speak English. So how did they pass? It's not because of me. I facilitate. You don't have to be connaissance. You don't have to speak English to comprehend. You remember I told you, Nadia, my partner who I graduated from school with, she spoke no English. En français. I spoke the English. She spoke French. We both went to NCLEX. We both nurse. Because she didn't have English. I was the English for her. But she had the comprehension. So it doesn't matter with English. I do the Creole for you. That's why I do the class Creole, Anglais. Pour pas gen raison pour dire ou pas comprendre. Right? I wish I speak Spanish. Hell, I sometimes throw that in. You see that? It's all about comprendre. You got it, people? All right. No excuses. Any question? All right. That is it of eye and ear. That's it. Let me recap what you're going to read. We're going to start from front to back. Recap what you should have highlighted. See, there we go to talking. 771, Snelling chart. 2, all of Snelling tests. Turn. 772, Fluorescent and Geography. Put a big NCLEX inside. Number 773, slit lamp C. E, tonometry. Turn. 774, I didn't do this with you, but I want you to read this little top. LASIK. You wear LASIK C, 774C. LASIK is the surgery. And let me, NCLEX love to ask you, when you do LASIK, which part of the eye they do the surgery on? Ready? It's a flap. Ready? You see the cornea. Cornea. That's it. Page 774C. Maybe D774, no matter what page. When? Maybe D774C. What page? When I me comprendre, when me 774C. Who not to what page? Not read what may be this week. So there are 88 baby, where they laugh. Right? But now 774C, legally blind. I use Francis. Know that. How to walk, I need you to read. And anytime I do something, I need you to read all of it. Remember, teaching, my job is to give you a synopsis. You guys know what synopsis means?
Yeah.
Overall, when you obey la vie, you're going to go read la book. Yes. D, cataracts. 2, what that cataracts? 2, 3, 4. And then you're going to do 54-4. Glaucoma, E. What that? Acute closed intervention 2. 776. What that? Retinal detachment. All to the surgery. Turn. 778. You're going to do all of the page. Right? 779. You're going to turn it. You're going to go to tuning fork. 780. You see the diamond? E2, E1, E2. That Romberg test is FC. Remember I said Romberg, F. F, yes. Go to F, 780. F, C. That's it. FC. There you go. They go that Romberg. You remember what I said, Romberg? Maybe. Now, diagnostic test for ear. The conduction, hearing loss, I talked about it, but it's right here. 781B. I talked about it, but that's where it is. Conductive versus sensorial. Conduction versus sensorial. That is 781B, turn, sensorial, C. 782, 5410, 5411. Hearing aid, 5412. About 5412. 784K, 5413. Mastitis, L. It's the same thing, go with 5413. K, chronic otitis mediatis. Mastitis is acute or chronic. It's the same thing. It's ear infection that's not treated. Remember I told you, ear infection, otitis mediatis, they put the acetic acid. When that don't work, that means the situation is worse. You need a myrectomy. Okay? That's what I'm talking about. Then we go to 786. Oh, you remember I told you, Meniere's syndrome, they sometimes call it labyrinthitis. P, Meniere's syndrome. P, all the way to the surgery. And 787S, 1 through 4. And that's your eye and ear. Man down. Know it. I did drugs, eye and ear, and I did disease, eye and ear. Now, on Thursdays, what do we do? After we do the disease, what topic do we do? Fundamental. What is fundamental today? We're going to do pre-op, post-op. Okay? So let's go to fundamental. While you